Good afternoon and good evening. I'd like to welcome you to the first Managing Survivorship meeting at Prostate Health Education Network. Again, we're at the Dana-Farber Cancer Institute. We have changed location, but we're still at the Dana-Farber Cancer Institute. I want to thank you all for coming, those in here with us and those who are online. We have a very exciting topic to talk about. But before we go into talking about intimacy and prostate cancer, I wanted to thank our sponsors. Dana-Farber Cancer Institute, Merck, Novartis, Pfizer, Exa, Lexus, Macrogenics, Foundation Medicine, and Bayer. And we want to thank these sponsors is because we're bringing content that normally people don't even talk about. So the title of this afternoon's or this evening's session is Reigniting the Flame, Rediscovering Love and Intimacy After Prostate Cancer. So I want to again say good evening. And this is our first fireside chat for the year. And what's interesting about this is I'm extremely honored to talk about this topic because it's normally not discussed. And there's a lot of misconceptions about it. So first, we know that prostate cancer is more than just a medical diagnosis. It's a life-changing event that impacts not just the individual, but relationships, partnerships, and families. And for many survivors, especially in the Black community, the challenges are even greater. Now, what's interesting is there's a lot of social media and negative information out there, but factually, 64% of Black men are single. Oh. I put that out there because how can you be intimate, or what's the perception of intimacy and love when the majority of Black men out there are single? And despite these conversations, there's not a lot of emphasis about sexual health. There's not. We talk about survivorship, but a lot of people don't recognize the importance of sexual health in managing your survivorship. So tonight, we're going to bring this conversation to the forefront. This conversation is not going to be focused on whether or not you have erectile dysfunction or you're incontinent. This session is about hope, it's about healing, and it's about the journey to help rebuild the connection and intimacy after you've been diagnosed and treated for prostate cancer. Now, what we try to do is bring you the best key opinion leaders in the space. And this evening, we have one of the best. Now, this is Dr. Sharon Bober. And let me give you a little bit of background about her. She is Associate Professor of Psychiatry at Harvard Medical School and a founding director of the Sexual Health Program at the Dana-Farber Cancer Institute. Her work focuses on sexual health after cancer, cancer survivorship and couples coping, and adjustments when it comes to prostate cancer. In addition, and this is important because she's a leader in this area, is she's also played a lead role on the international panel that recently published the first clinical guidelines for addressing sexual health for the prostate cancer patient. So together, we're going to explore this area, this important area. And hopefully when we finish, we'll address many of the misconceptions that are out there. So, Dr. Bober, I'd like to invite you online, if you can turn on your camera.
Pleasure to be here.
I'm glad to have you here because we have a lot of misconceptions. And after we happen to have a discussion before the event, and we have a lot of topics to cover. So we're gonna move through this, hopefully and address a lot of key points. But first, when we start talking about this category of just survivorship and challenges. So what are some of the biggest challenges prostate survivors face? Especially when you're talking about the psychology, the emotional hurdles of dealing with prostate cancer.
Thanks for starting with a small question. Big question, right? I mean, because we know that actually, first and foremost, when people go through this experience, we also know that the impact is not only during treatment, but there are really long-lasting impact on people's experience, not just only of themselves and their identity, but of what's happening in relationships, what's happening in terms of their capacity to have relationships, form relationships, for a long time on the other side of when treatment ends. We also know that more and more men are experiencing some treatments, for example, androgen deprivation therapy, hormonal treatments that actually go on for years, right? So that it's not so much about being on treatment or off treatment, but often these experiences go on for a long time. And the impacts go with that. So people clearly struggle with, question about just distress, depression, anxiety. What does this mean in terms of, health and well-being, and looking at all of the kind of issues around longevity and what that means for incapacity for function day to day. And we also know from the point of view of specifically sexual health and masculinity and body image and sense of self-esteem, that these are real and profound impacts that people struggle with every day. It is not something that people only think about for a little bit of time or only lasts for a little bit of time, but in fact, actually, some of the side effects, the sexual side effects, are some of the side effects that last the longest. And I think that we really need to have this conversation. I'm really happy to be here with you today, because quite honestly, we know that when we do surveys with men across the country and ask what are some of the most distressing aspects of having had prostate cancer, this is actually one of the top couple of things on the list over and over. So I think it's a really important step to kind of shed some light on that and really kind of bring it out in the open, and acknowledge something that I often think of as the elephant in the room, because it's on people's minds. People are thinking about it and wondering and worrying, and yet there's not a lot of frank conversation about it.
It's interesting you said that. You didn't just say one factor that's responsible here.
It's true.
You said multiple factors are responsible. Now, when we talk about different ethnic groups, is there something this impacts all ethnic groups, Black, white, Hispanic, every majority of men that you deal with?
Well,
the table the same way or feel the same way?
Yeah, it's a good question. I think that there are certain things that are probably somewhat universal. I would say that across the board, when we look, for example, at when we look at the qualitative studies that have been done with prostate cancer survivors from across ethnic groups, African American men, Hispanic men, white men, there are certain commonalities that do jump out. People are really struggling with a feeling of masculinity. People really struggle with feeling kind of whole, or people worry a lot about what that means when they feel damaged in some way, right? Because of the treatment that they've been through. My sense is that those are some of the experiences that are very powerful and are probably somewhat universal for men who go through this experience.
So you brought up something that was interesting. There's this key word that floats around: masculinity. Man. So you find that a lot of men tie manhood into their ability to have an erection?
Well, I'm not the first person to say that. I mean, I think that, sociologists, anthropologists, have been reading and writing and, not been about for, centuries. I mean, we know that that's probably part of, is probably part of how we are. I mean, I would say that's a good example of something that is probably deeply ingrained at a lot of levels, right? It's both a physical experience. We go through puberty. We have an experience about, becoming a man and moving into adulthood. That's very sort of tied to the physical experience of moving into, capacity to be a man in that way. But we also know that from a cultural perspective, and this is where I would say there probably are some cultures that have differences or cultural variations, but in reality, there's a huge cultural overlay, right? That we that we sort of all live in around what it means. I would say, similarly around femininity too. What does it mean to be a woman? What does it mean to be a man? And those are kind of experiences that are largely also constructed or supported by the culture that we live in. So, if it is, I would say that it sort of amplifies a lot of the experiences that we have individually when every time we look at a TV show or watch a movie or have a conversation about, what it means to be virile, to be masculine, to be a real man, it's kind of assumed that it also has to do with erections and having sex in a certain kind of way. And I would say that, that is both on one hand, very normal, but on the other hand, it's very limiting, right? When it comes to some of the changes that most men go through at some point in life.
So you believe, I mean, and I believe the same thing, is that having the ability or having erectile dysfunction does not make you less of a man.
100%.
And so we want to be clear, because a lot of people feel that it makes them less a man, their life is over. And so men or being a man or manhood is more than just having the ability to have sex. There's being a father, good husband, a good friend, good family, good community. All these play a role in masculinity, and not just whether or not a organ in the body works or doesn't.
I 100% agree with that. I would say that, masculinity, manhood in the most essential way, is not defined only by a body part. I think that is a very limited perspective. I also want to acknowledge that the feeling is real, right? So I want to, if that makes sense, meaning that, when I sit with men, which I do every week, and people say to me, I don't feel like a real man, I want to also say that I take that seriously, right? This is important. And I don't want to in any way, I want to acknowledge that those feelings are real, right? And that we live in a world, we live in a culture that constantly pushes a kind of a very specific and narrow view, I would say, on what it is to be a man. So given that,
Right.
I think that we actually have some work to do, right? I think it's really helpful to be able to help people be more flexible, right? Be able to sort of appreciate that there are lots of ways to express themselves, to be a man, to give and receive pleasure, to have relationships, to feel strong, to feel competent, and recognizing that you could have all of those experiences and still certainly appreciating that there's a sense of loss that I think is real, right?
Right.
When we go through these experiences and have treatments that render us different than we used to be, including dealing with something like erectile dysfunction. I just really want to say, I don't want to minimize that either.
Right.
That's real. And the sense of often grief or loss is powerful too.
So it's interesting that you say that. And well, what should men walk away with tonight, just about this topic here, about you're more than just your ability of one organ to function. And is there tools that you can help them deal with thinking about it? Should you go to a sex therapist or sexual health program at your hospital? How do you retrain? How do you appreciate the new normal?
Thank you for asking that. I would say first and foremost, I think even just having a conversation like this is powerful, right? Every time I sit with a guy who says to me, I would like to just talk to one other guy who's gone through this and hear what his experience has been like, but people don't talk about it. You know, even just recognizing that these feelings are normal, right? That these feelings are not something that they're not, because people feel ashamed to talk about this. People feel that this is a topic that's embarrassing to talk about. I would say that, again, I'm not happy to talk more of the specifics of some of the strategies that we use, but just to be very clear, even just having the conversation normalizes this, allows people not to feel alone, allows people not to feel like there's something wrong with them, because when you walk down the street, everyone else seems normal, but there's something wrong with me. That's actually a feeling that people have when we don't ever talk about it, when it's not acknowledged.
Right. So,
oh, sorry.
go ahead. Do you have another point you want to make?
And the other piece I just want to say is that that's also the case when it comes to relationships, right? So your point, which you made just now about not feeling like a man and often worrying about, what a partner might think or what prospective partner might think. Part of the problem is that when we're isolated, we avoid the whole topic. We sort of don't deal with it at all because it feels like it's too stressful. There's something that's always kind of a relief when you avoid something that feels stressful. But the problem is that that avoidance, that sense of relief in the moment, reinforces this idea that it's too difficult to deal with, or that it must be true. It must be so stressful. This isn't something I can deal with. When you avoid something that feels stressful. And I would say, when, for example, I often meet with couples or in relationships, a partner might say, if somebody could actually hear their partner say, listen, I don't feel like myself, I don't feel like a real man. Sometimes if you could actually find a way to communicate that, to hear your partner say, oh my goodness, that's not how I feel at all, right? I still see you as the same person that you have always been. That's therapy. That's intervention. That's powerful. But if you don't have that conversation and you don't put yourself out there to be able to even talk about it, then sometimes people also end up just kind of assuming something without actually being able to test out that reality in a relationship with a partner, for example.
And so it works very well, right? If you have a partner, if you're married, or if you had an intimate relationship before you went on your prostate cancer journey. But what about, I mentioned earlier, there's 64% of Black men who are single. So do you think that having intimacy is over with because I don't have a person right now, or is it over? Is that the way people are going to think, or how do you get over that?
So I think that there are lots of reasons why people are single, right? Why people are unpartnered. And I've heard, I know exactly what you're talking about, that we know that the majority of African American men are not partnered, and so more than 50%. So we know that, and I think that there are probably multiple reasons, right? Factors that contribute to that. But what I would say is that specifically from the prostate cancer perspective, or from the perspective of effects of prostate cancer, I feel very strongly that I want to give people the message. The idea that a prospective partner would not want to be with you only because of capacity to have erectile function is really not an accurate, I would say is probably not fully accurate. I think that there are probably some people in the world who would say, gosh, I wouldn't want to be with somebody if they've had cancer. I wouldn't want to be with somebody if they've lost a limb or can't get an erection. I mean, there are always folks out there who might feel that way. But from my perspective, those are probably not going to be the people that someone would want to be with, right? If you've gone through something difficult, you probably would want to be with the kind of person who would want to be with you for you, right? Not because of a specific body part or whether you are thin or fat or, tall or short. Like these are very limited kind of perspectives. And I think in general, when we think about dating and relationship building after cancer, not only prostate cancer, it's really important to remember that in general, the people who are looking for sort of honest and deep and real relationships are looking for a whole person based on who they are inside, based on their character, based on their commitment, based on their capacity to communicate. The kind of issues that come around, body parts and sexual function, believe me, we can deal with those. There are maybe accommodations and we can talk about those, and there are plenty. But the idea that it's a deal breaker at the beginning for all relationships, I think is probably painting with too broad a brush. I don't think that is really the case all the time.
And that's important for the audience to really recognize, because a lot of people think it's over with.
Yeah.
Over what, to the point where some people have been reported to have taken their life. So this is why this message is never over.
Right.
So
and I just can I just add one piece to that?
yes.
And I want to just say that again, you talk about, things that are specific or universal. I sit with women who've had cancer and who say the same thing to me. Nobody would want to date me because I've had breast cancer, and then I sit with men who say, well, nobody would want to date me because I've had prostate cancer, or nobody would want to date me because I had leukemia. And, honestly, everybody has some of those worries, right? When we are not the way that we used to be. But what I would say is that, for people who are looking for a real, and I would think of as an authentic relationship, it's not about a body part, right? It's not about something that is one dimensional. They're looking for somebody who's a real person. And I think that's really what makes people commit to a relationship.
I mean, I wanted to make sure you reinforce it. I want the audience to make sure that they heard it over and over again. It's the new normal. It's another portion of your journey. We have a saying, it's called TPSA, and it's you troubleshoot, problem solve, and adapt. And that's how we adapt. Now, this kind of allows us to segue into intimacy and relationships. Okay. So, I mean, this is a very important topic. But what you mentioned other diseases, but isn't it true that, prostate cancer is probably the only couple's disease? So what are your thoughts?
Well, I would say, sure. I mean, we know it's a couple's disease and we know it affects both partners. But 100%, I would also say that, just to sort of pick up on sort of moving from what we just said to what we're now saying, when I think about, for example, what does that mean when, let's say, we're dating, a guy wants to start dating somebody, but, needs to use a sexual aid, can't get an erection naturally, there's some kind of change in function,
Right.
So when I like sometimes do these dating workshops, right, where we talk about that. And I say, okay, so what's the big difference? Well, right, from the get-go, you're going to want to take it slowly, right? You're going to want to get to know someone. You're not going to want to just kind of, you can't do, you're going to want to take your time, get to know whether this is someone worth investing in. And then when it comes to actually getting intimate, it's not going to be something that you just kind of jump into, but that you're going to want to put one toe in the water and you want to share with that person what you've been through. And this is something you're going to do together, right? That's a kind of slow roll into something that you might have done differently when you were 20 years old. That's fine, but it's different now. And what I would say is that, what's interesting, especially in midlife and beyond, for most women, that's a very comfortable tempo, right? For lots of partners who are dating at midlife and beyond, that for men and women, that feels fine. You know, people aren't expecting something to go from 0 to 60 in 10 seconds, or someone to go from 0 to 60 in 10 seconds. But people are very happy to get to know each other, to be able to communicate, to be able to see if they can kind of trust each other and feel comfortable and share a little bit at a time. Like that tempo can really work well to in the kind of dating context, right? As you're getting to start a relationship, that doesn't have to be something you have to worry about. That can actually be an advantage.
Right. So that's very interesting because now we live in a society where, intimacy with someone may be very rapid. People may, instead of taking that time to date, appreciate a person, understand a person, and know a person. And really, I think it starts to reinitiate this whole concept of what love is and intimacy is with a person versus, what media wants to sell and why they want you to have Viagra or Cialis. Yeah.
Right. And I would also say that that's so you took the words out of my mouth because what I would say is that, what we see on TV and movies, I think is very different than real life, and in real life, especially as we get to be, let's say, midlife and beyond, right, as opposed to maybe what things look like in high school or college. For most people, starting relationships, dating, developing a connection is better and deeper when it is slower at the beginning and you get to know each other and you're able to communicate.
Or if you've known the person for some time and
That's
you
true.
reestablish a relationship with them, then it is different. It is, you're getting this, you're having the opportunity to see the real person and then really fall in love, because this whole concept of what falling in love, and that takes time or may not. So then I have a question that comes up. This question is, explain to me about libido. What
Uh-huh.
is, and is it just the moment you start, you have prostate cancer and you have surgery or radiation or you have hormone therapy, you're a sexual zombie. You're just like, I can't feel anything. A lot of people perceive that.
So I'm glad we're talking about this because this is one of those things that again doesn't get talked a lot or enough about. So what is libido, right? We use that word. Sometimes people call that desire. There is something about going through puberty, right? And moving into kind of through adolescent development and into maturity, both for, men and women, where all of a sudden, we have kind of adult hormones, right? Adult hormonal fluctuation. And there's certainly a kind of biological element of that, right? Where when we know that, especially, again, sort of late adolescence, or adolescence into adulthood, young adulthood, there's a lot of hormonal drive, right? Hormonal fluctuation, which feels powerful, right? And that is real. As we move into adulthood through to midlife and beyond, for men, can talk about women differently, although it's relevant, supposed for partners. We know that hormones naturally start to decline, right? In terms of, for example, testosterone for men. I mean, that's something that happens, in a slower way than women. It's not like they don't go through menopause per se, but just naturally there's a decline over time. Obviously, when we go through prostate cancer treatment and there is any kind of a severe or treatment related, end to hormone, right? That's a big hit, right? People often, when we talk about the hormonal treatments, androgen deprivation therapy, lots of men find that it's not just desire that changes, but people just don't have a great sense of vitality, vim, vigor. There are metabolic changes. People often don't have the same sense of drive in lots of ways. What?
Depression because you're sad because you have prostate cancer, or
So
is it? I'm
So
sorry.
I, yeah, so I would just say, so the way that I think that we think about it, you know, hormones are like one very important recipe, ingredient in the recipe, but it's not the whole thing, right? There's all these pieces that get layered on top of that. So to your point, you know, if we feel worried, if we feel anxious, if we feel depressed, if we feel distressed, that's going to have an impact on desire. We also know that, again, loss of testosterone and loss of a sense of vitality, you know, can also make people feel depressed, can make people feel worried or anxious. But I also just want to say that when it comes to desire in terms of romantic desire, in terms of sexuality, you know, it is not only about hormones, right? A lot of times when we, you know, when men aren't able to get an erection naturally anymore, or they notice that their body is different than it used to be, people have a lot of feelings about that. You know, people might feel embarrassed, people might feel ashamed, people might feel frustrated or anxious or upset that they didn't expect some of these changes. You know, that can impact how you feel about yourself. If you don't have the same sense of self-confidence that you used to, that can be another factor why you may not want to put a toe in the water, right? And again, so I just want to say that I don't think desire or libido is only about hormones. I think that's one of the factors, but I think that there are lots of different pieces to that puzzle. And I think, you know, to your point that you said before, you know, if people don't feel like themselves, you know, if people feel at some level damaged or worried or embarrassed about what a partner might think, it could be a lot easier to avoid, you know, kind of this whole aspect of their experience. And the more we avoid something, that also has an impact. You know, the more we avoid something, we kind of tune out and turn off, and then it kind of becomes farther from our day to day.
But you said something, damaged,
Hmm.
but people feel like they're damaged goods.
They
So
do.
how do you overcome that?
So I think it's important to, again, acknowledge that the feeling of loss is real. I think that, you know, just starting by normalizing that for people is important, right? Recognizing that some of the long-term side effects of treatment that affect you are honest and are real. So I don't want to pretend it's fine. You know, it's not fine when people feel a sense of loss. And this is the point that's important, it's not or. And there are still lots of ways that people can feel confident, that people can feel productive, that people can feel that they can have meaningful relationships, that people can give and receive pleasure, right? So I think the point here around, you know, feeling like damaged goods, my goal is not to say to someone, don't feel that way. Because one, I think that's silly. I can't make people, you know, we all feel how we feel, and those feelings are powerful. But what I do know is that that doesn't have to be an endpoint. That can be just a point along the way that we acknowledge. And then we say, okay, so now what? What can we do to regain or to recover, right?
Mhm.
A sense of feeling like I can be, I can have impact in my world, right? I can make a difference. I can do something meaningful. I can have a relationship which is positive, or I can be productive, or I can have be a good friend, or as you said, family member, partner in the community. It just, there are lots of ways to regain a sense of self, even after we go through something that feels damaging.
Mhm. So, 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 so they may be damaged physiologically, so having erectile dysfunction, but is there a distinction between the ability to have an orgasm and ejaculation? But that's normally a combined function or event with men. It's normally not separated. So is there a separation, or do men even have orgasms?
Right. So a couple things. If it's okay, I'm going to go back to the one thing we just said before. Even though erectile dysfunction may be a very common and significant side effect of treatment, I really just want to say this. There are a number of strategies that we have from a mechanical, medical perspective that we can do to address erectile function. And it's not just the little blue pill, right? So, and I know that, so I really just want to say first and foremost, it may not be that you can get an erection naturally in the same way, but there are, from a mechanical point of view, we have a lot of strategies that can help men get an erection after treatment, even if it's not a natural erection, but that allows them to functionally be able to, let's say, have intercourse or penetration. So I want to say there is help for that, and we could talk about that. I would also say, from the point of view of other aspects of sexuality, like you said, for example, orgasm, the experience of climax, believe it or not, that is not something that you need to have an erection for, right? And again, we talk about how, we learn who we are based on our past, right? So you go through puberty, you kind of come into an experience where erection and orgasm happens sort of simultaneous. But in fact, orgasm happens as much in the brain as it does in the genitals. Men are certainly able to have pleasure, to feel aroused, even to the point of climax, with or without an erection or a full erection. That gets a little more complicated when people are on ADT, on hormone therapy. I will say, when you have no testosterone, that's a good example of where, from a hormone perspective, it can be a little more difficult to achieve the experience of orgasm. But certainly, it's really important to recognize that you don't have to have an erection in order to be able to have orgasm.
Because I think that a lot of people didn't recognize that these are parts of intimacy.
Yeah. Sorry, can I say one more thing about that, Keith? One thing which I think is really a powerful and positive experience for men who are in a relationship or who have a sexual partner. When people are able to experience arousal, right? When people are able to sort of get turned on, partly from having pleasure themselves, but also from being able to give pleasure to a partner, right? Being able to help their partner get turned on. That's one of the ways that people can get turned on themselves. And I think you and I were talking a little bit about desire before we started. One of the things, for example, that men often find, even who are folks who are dealing with androgen therapy and, or deprivation therapy, and they say to me, well, gosh, I don't feel like myself. What can I do? It is really interesting when they are able to be with a partner and they're noticing that they're able to get their partner turned on. That's extremely exciting for them. And that is like a really great way to partly also kind of wake up your own experience when you notice that you're able to pleasure someone else, right? So this is where I would say this is a couple's experience in many ways. And so when couples are able to be more, I would say, expansive or creative, in that, there are all kinds of ways to have touch and sensual experience that may not look like it's only focused on penetrative intercourse. It can be very arousing. It can be very exciting. It can be very passionate. It can be very sensual. And I would say that is sex, right? Sex is not only defined in a limited sort of way, but if we can have a more expansive perspective, people really can have a very rich and sensual and erotic experience with or without penetration, with or without an erection.
So to a certain extent, you're talking about going back to foreplay.
I mean, you could call it foreplay, or you could call foreplay the main event. It really depends on your perspective.
Right, or it becomes the main event. Okay. So men have to learn how to begin to give pleasure instead of being a recipient of pleasure.
I mean, I would say that becomes a good thing for everybody, right? I mean, it's really about figuring out how to both give and receive pleasure. And I like the fact that you use the word pleasure, because that again kind of opens up the experience, right? I mean, again, you and I don't know each other well, but I'm going to just speak frankly, as people know if they've ever talked with me before about sexual health. For example, most women will tell you, if you ask them, you don't need to have an erect penis in order to be able to pleasure a female partner, to be frank, right? That there are lots of ways to do that. That may include that, but it may not, and that's okay, right? And lots of female partners will be very honest and say, listen, there's a lot more to what we do than just penetration or penetrative intercourse that feels good for me, right? And so I think being able to just be able to sense, open up the experience to be sort of have a more broad experience is really good for everybody.
So it's important then to have dialogue, communication.
I believe that is true. I would say the most important part of good sex is communication.
So I think that that's a very important point for everybody to understand. So when we start talking about adapting or the new normal, communication has always been, I think that's the underlying point that you've made. When we talk about survivorship, then it's about communication. So what I wanted to do is, I think I kind of covered some topics. Is there anything that you think that we didn't cover that you really want the audience to really walk away with, to understand before we start answering some questions?
So I guess I would say that there's hope, that this is that there is a lot more support now for men and partners and couples after prostate cancer than there was when I started doing this work 15, 20 years ago. I think that, it is not just people don't have to go through this alone and figure it out themselves. There is help out there.
Now, the first question is, how does a man who is single, see, we brought up this whole point about being single,
Okay.
going through prostate treatment, bring up the topic along with the potential sexual side effects that may come from it. He's single, going through the treatment, but wanted to move forward in a dating scene, but wants to also be fair.
Yeah. So I would say that, again, I'll just give you an example of what I recommend. I would say, say you've gone out on some dates, you seem to like this person, there's some good chemistry, it feels like they've gotten to know you a little bit. What I recommend is that people start with sharing a little bit of information and put it out there, right? So you don't need to start with saying, oh gosh, I can't get an erection. I think that's probably not probably the best way to start. But I would say, I've been through a lot. I had prostate cancer, and that was I had to deal with a lot with that. And I would sort of just stop right there and see what the person says. If they look and lean in and say, oh my goodness, how are you doing? Tell me about that. You could say, one of the things, I'm doing well, I feel pretty good, but one of the things that's different is that, I have to, sexual function isn't the same as it used to be. I just say it like that, and I need to, take my time, and sometimes I have to do something to help me with that. Honestly, if you said something just like that, right, or it's not the way that it used to be, most women will just basically not even think twice about it. It is really not nearly as much of a thing as you may think it is. I guess that's what I would say. But I think you have to just put it out there and then let your partner, say, okay.
Jerry, do you have some questions?
They want to see her.
Sorry?
I was just,
Shifted the screen.
question,
Shift the
He
screen.
shifted the
can't even.
Shift the screen.
Oh. So our next question?
Okay, should the sexual partner be a part of the conversation when going through treatment?
Sure, I would say, why not? Of course, I don't think that there's any downside to that. From my perspective, I think that I think that in general, patients and partners together often are not fully informed about some of the side effects of treatment. And I think that, not because people don't care, but often there's just a lot on the list to go through. And I think that it is helpful for both partners and patients to kind of hear as they're going through this, what to expect. I also think that most partners are usually very supportive when it comes to being creative, right? When it comes to saying, what can we do together? How do we take our time? What would be helpful? I think the biggest issue with partners is that often people just don't know, everyone's trying to protect each other, right? So what I often sort of struggle with, or I see people struggling with, what I often help them with, is that neither partner wants to talk about it because nobody wants to make anyone feel bad. And what happens when there's that kind of silence between partners is everybody tends to fill in what they imagine that their partner's thinking. And it's often not totally true or fully accurate, right? So even with the best of intention, people sort of avoid the topic because they don't want to embarrass or upset the other person. And actually what both people need is a way to be able to check in with each other. Does that make sense?
Makes a lot of sense. And even to the point where we're talking about bringing that your partner with you early on, or talking about sexuality or intimacy earlier on in your prostate cancer journey. So I think that's going to be important. Jerry, do you have another question?
Yes. Do any of the ERD medications work with prostate cancer patients?
What kind of,
So I'm assuming that means like I don't know what ERD medications is that for does that mean like, or is that a reference to like Viagra, Cialis? Is that
Right. Mhm.
Yeah. So the thing about the oral PD-5 inhibitor drugs is that actually often they do not work or do not work adequately if there has been nerve damage from surgery, or in the context of like long-term damage from radiation treatment, or if you are on a medication that's getting rid of all the testosterone. And what I would say is that this is important. People often are given a prescription for something like Viagra or Cialis, and it doesn't work. And the assumption is that nothing will work. And what I really want to convey is that even if the oral pill is not adequate, we have other medical strategies that are still very effective. So specifically when you're looking at trying to get an erection after prostate cancer, if the oral medication is not helpful, there are other ways we can deliver that medication directly to that penile tissue. There are also non-pharmacology options, like a vacuum pump. Men can use a constriction band at the base of the penis to help keep blood flow in the penis. We really have a number of other sexual aids that we can use that are actually pretty effective in order helping men either get or keep an erection. So I would just say that sometimes the oral medications are effective, sometimes they're not. And if they're not, we do have other options.
I had a question because the more and more men are living longer.
Yeah.
Into now it's almost like a chronic disease.
Yeah.
A lot of questions or points that people are bringing up about why would I wait and go through the pill or the pump or the injection and just go straight to just getting a penile implant. So a lot of people, what are your thoughts?
The implants are great. They actually are not like the implants from 20 years ago. They look, you'd never know you'd have them if you're sitting in a locker room. They work really well. A lot of men are just squeamish about the idea of any kind of a surgical intervention. But actually, the prosthetic pumps that are surgically implanted are very effective. And men who have them, the satisfaction rates are more than 95%. So I would say that is, if that's something that people want to consider, it's a great option. I just know that sometimes people are just not interested in another surgery. But pumps work really, really well, and people who have them are happy with them.
Okay. Sharon, you have another question for us?
Yes. How does low testosterone level affect work and athletic performance?
So, I think there are probably other folks who can address that probably better than I can, but I would just say in general, we know that, when people have low testosterone, it sort of across the board can have an impact on sort of overall sense of vim and vitality. We also know there are ways to compensate for that, primarily with exercise, specifically weight-bearing exercise, as well as, diet and exercise and other types of, kind of, I would say, physical well-being. So I think that, that's something that's sort of a well-known side effect, but we also know, for example, that the recent research looking at like weight-bearing exercise is really, really helpful when it comes to regaining some of that capacity.
And just to plug for the Dana-Farber, they're doing a lot of exercise, diet-related clinical trials here. So it'd be very important for our audience with inside your area, if you're near centers, look and see if there's exercise or diet-related clinical trials that you can participate in. Jerry?
Yeah, this person said, I feel the struggle with the whole process of intimacy after surgery. And I feel less than. I've tried to get my wife to go with me to a therapist or for some external assistance and cannot seem to get her on board. How do I approach the matter of getting her on board to see a therapist?
You
or
might have
as
to
a
speak a
professional?
little louder. You have to speak louder.
Oh, how do I approach the matter of getting her on board to see a therapist or the professional?
And this would be a therapist to see together as a couple. Is that right? Yeah, I'm just,
Yes.
yeah. So look, I've been a psychologist for a very long time, and I still don't know how to make people do something they don't want to do. I have yet to figure that out. But I will say this, I think if you can convey to your partner that this is just really important for you, right? That if is from the point of view of just as a couple, that this would be incredibly meaningful and important to you if she would be willing to come along and support you, in the context of a conversation. It's not so much about somebody needing a therapist because there's something wrong with them, but it's really about trying to sort of figure out new ways to sort of expand your relationship. And that if it would be helpful, to say to your partner, this would just be really meaningful for me. Would you do this for me? Right? Is this something that you would be willing to share with me? It would mean a lot. And I'm asking you, to just consider that. I think that's what you can do, and that's what you can tell them what it would mean to you. And then you have to see if that would be something that they would be open to.
I have a comment and then a question. The comment is, I heard earlier when you started, you said, this is a conversation you wish more of your men would have. So I want to remind you that we here at PHEN have this meeting once a month, and we have members who've been diagnosed over 20 years to newly diagnosed. And we have these type of conversations here. So I understand where you're coming from. So let them know that there's a place to come to get some answers. And
That's great.
my question is, you mentioned the implant and the pump. What are the side effects or negative things that can happen from those two things?
Oh gosh. So very quickly, I'll just say, in terms of there are two very different types of sexual aids. A pump is a penis pump, is a vacuum erection device. It works. It's mechanical. It's not medical, not pharmaceutical. You're talking about something that is sort of essentially a plastic tube that you can place over the penis, create a vacuum, and sort of by drawing the air out. You can also pull blood flow into the penis that way. And then with putting a base at a ring at the base of the penis, you can sort of hold the blood flow in the organ. That is, I would say, mainly you just kind of have to figure out mechanically how to use that. You want to use that in a way that you don't bruise yourself or hurt yourself. There's really no big downside to it. I just think that it's a little awkward if you're not used to using it. And quite honestly, there are a lot of really good YouTube videos and a lot of teaching videos that we can get, which, make that pretty much more easy to be able to watch someone use that to practice. So not a lot of downside to that. In terms of surgery, obviously very different kind of procedure. But as I said to Dr. Crawford, the prosthetic penis pumps that are implanted surgically work very well. And if you're working with a surgeon who's a competent urological surgeon, the failure rate is very, very low. But I think, like anything, it is a surgery, and there's always, the pros and cons of that you have to consider of any surgical procedure. But I would say that the pumps are a very different animal than they used to be. They're very effective, and the failure rates are very, very low. They're very successful.
My question is that those people who have had it, have you had reports of problems with them? That's my real question. Have there people who use it for a while say, well, I had these problems?
I would say, I mean, again, just from knowing the literature in general, the satisfaction rates are very high, and most people who have them are very happy they have them. The one piece I will just sort of remind people about, if you don't know, is that once you get a pump, the only way to get an erection is by using the pump, the penis pump that's implanted surgically. So, for some men who may be able to get a partial erection or, naturally, that change, once you have the pump implanted surgically, that is the only way that you can get an erection at all. But in general, people are quite pleased with them. And I think it's always just worth having a conversation or consultation with one of the urology surgeons to talk about that.
Okay, I have a question. I don't know if it's for you or for the urologist. I've had the surgery. I had the prostate removed. I can bring myself to climax through masturbation.
Mhm.
Once I reach that point, I ejaculate fluid. Is that just mere into my bladder, or what is it at that point?
Are you asking what that fluid is, since it's not ejaculate the way that it used to be? Like, what is coming out?
Yeah.
Yeah, so it's probably it may be a little bit of urine. There also is some fluid that's made by some of the glands that can be secreted at that. It's not ejaculate like semen, but there's nothing dangerous about that. There's nothing that is that you would have to worry by yourself or for a partner that could be harmful in any way. It's pretty neutral.
I just wanted to mention also a couple of things. That a lot of men, when they do get prostate cancer, they're at the elderly age. So I talk to men all the time. And they say, well, what about, the sex and this and that? And I tell them, you're going to live longer than your penis. So, that's not going to be a real issue, And I talk to men, and some men have high blood pressure. Some men have sugar diabetes and they take medications. And that right there has a problem with them having sex.
Sure. Yeah.
Just prostate cancer.
Right.
Other issues and other health issues.
For sure. Yeah.
Men have. And going through the penile implant, I have researched it. I seen the operation. It's not that bad. You're in that day and you're out a couple of hours later.
Mm-hmm.
And I've talked to men and they enjoy it. So I don't see a problem, with that. And also it's covered by your insurance.
Mm-hmm.
So that prostate cancer, it's covered by your insurance.
Mm-hmm.
Okay.
I thought it was covered by Medicare.
Thank you.
Yeah. Yeah, the pumps are, I think is something that often people don't consider enough. People who have them are very happy with them generally.
How about you having an orgasm?
Sorry?
Feeling an orgasm, but nothing comes out.
So that's typically the case, right? What people have what's called a dry orgasm. Most of the time, typically what happens is people can reach that experience of climax, but because the prostate is removed or not working anymore, which is the prostate is what produces, typically what ejaculate semen. The experience of orgasm is dry. And I will say that for many men is a big loss too. We talk about that with gay men a lot. We talk about that in multiple other contexts, that that is a real loss, which I want to acknowledge. Sometimes that loss of ejaculate is it's real, and people feel like it's something that's a little bit missing, or a lot missing, and I don't want to pretend that that's not true. That's a real experience that people have. That is a loss, and again, not trying to diminish the fact that people have a lot of strong feelings about this, and that's part of it.
Yeah, you said when someone has lost no longer has the prostate, but how about when you still have the prostate?
Well, even if you have the prostate, if it's not, for example, if you've had radiation therapy, or if you've had a type of treatment where the prostate is no longer really sort of functioning to produce semen, you're not going to have ejaculate during
You-
typically.
But you will
What?
feel, but you will reach that point of orgasm, but nothing coming out.
Yeah, exactly. I mean, orgasm, it's interesting. What is orgasm? It's an experience that you have biochemically in your brain. It's an experience you have because your pelvic floor muscles contract, you hold tension and then they release. It's not only happening just in terms of the experience of the penis and the prostate. So, you can still very much have an experience of arousal to a point of a sense of release or of orgasm.
Thank you very much. Jerry, are we, any more questions, or are we going to?
There is one, we could go to the poll and then you could answer
Okay.
questions.
So what we want to do is we're going to go to our poll survey online and survey some questions, and we'll still try to answer some questions while we're conducting the survey. So Jerry, you have a question?
Yes.
You have to speak a little bit.
Yes. When is the appropriate time to broach the subject with a new woman you're speaking with?
I would say whenever you are feeling comfortable that this is somebody that wants to get to know you, you're starting to have a sense that this is somebody who is genuine and interested in getting to know more about you, there's no wrong time. I would say the only time that's not the right time is if you have a gut instinct that this person doesn't really want to have a real conversation, right? But if you're kind of tuning into each other and you're feeling like this is somebody who's interested in getting to know you and you're feeling comfortable, at any point, it's totally okay to say, one of the things that I've been through is prostate cancer, and that, that was definitely something. I'm doing well now, but that was a lot. And if you'd like to hear more about it, I'd be happy to share more about that with you. I don't think there's a wrong time. I think what's important is to tune into what you're feeling when you're with that person, and to get a sense whether you're feeling like this is somebody who really is interested in sharing honestly about each other.
Yeah,
Dr.
Okay.
Crawford, am I talking too much?
no, excellent.
Okay.
Because it's probably the only place that people are going to get this information answered.
Okay.
Yes. Another question, is there a high rate of infection with a surgical implant? And if so, how effective is the removal and recovery?
Oh, goodness. I think this is probably more of a urology surgeon question, but
I mean, if you want to answer it, because we're talking about the infection rates are low, and
Yeah.
then it was answered earlier about 95% satisfaction. So 95% of those who have it are satisfied. There's not a lot of accompanying side effects, but we can go over that our earlier session where we talked about some of these rehabilitation tools in more detail.
Yeah.
And then we can also also bring the question up again. And we can, if you send it, we can also get more details for it to answer that question. Can we have another question, Jerry?
Sure. How can someone with a history of prostate cancer find a qualified sex therapist to help with sexual health?
okay, that's a really good question. So I would say the best way to find a qualified sex therapist is, what possibility is to come to a cancer center, like a place like Dana-Farber, where we have folks on staff who do this work. Another, or Sloan Kettering, or any of the other sort of major cancer centers typically have folks who do some of this. The other thing is to really sort of go through an organization like I'm thinking of the Society of Sexual Medicine, SMSNA. That's what is that? Sexual Medicine Society of North America has a, there are websites that are have find a provider type website where there are a lot of resources directly for patients about how to find providers who do this work. And the other piece is that, I don't know, does PHEN have anything online, Dr. Crawford, for resources or?
We can find something for you, but from the standpoint of clinical trials, we do, but we also have access to some resources. So if people get in contact with us, you can tell us what state you're in. And then we
Right.
can, what the closest organizations can provide. I mean, we have. But
the other.
again, the question is, if you have a directory.
Well, there is, so the directory, there is something called, the organization, that's probably the largest organization, called ASECT. It's AASECT. It stands for the American Association of Sexual Educators and Counselors and Therapists. They have a very comprehensive find a provider directory by state. Online. So these are certified sex therapists. So again, I can't speak for everybody, but they go through a rigorous certification process, and it's asect.org. If you just Google that, AASECT, ASECT has an excellent find a provider directory for patients, and that's by state.
And so I'll repeat it again, Jerry, if you can put it in the chat. It's AA, right? SECT.
Yeah, I do. If you want, I can try to find I can try to pull that up as well.
All right. And
Yeah, this one is very.
You have another question?
Yeah, this is a very broad topic, but someone wanted this one answered. From everything that was discussed, would there be a difference if it was a gay relationship?
Could you speak up a little bit?
Repeat the question.
Yes, with everything discussed, would there be a difference if it was a gay relationship?
So I think there are definitely some things that are specific to gay men that need to be acknowledged. I think that there are definitely many of the elements we talked about today that are the same for men, gay or straight. But I want to acknowledge that I think gay men, again, talk about some of the differences. These are gay men often do not get any attention to this issue because people are uncomfortable about how to have this conversation or start this conversation. And there's lots of stigma attached, especially with folks if they're not comfortable. I want to acknowledge that for anal sex, you need an erection that is typically a stiffer erection than for vaginal penis intercourse. That's honest. I think that it's often the case that, for example, loss of ejaculate, we know when we do surveys with gay men that, this is something that's a profound loss. So I want to just acknowledge that some of the issues are very similar, but gay men definitely have some of their own concerns that are real. And I think it's important to be able to get the support they need and to be able to have someone to talk to about these issues. And there definitely are sexual counselors and therapists out there that do a lot of work with sexual minorities, including gay men, who would be able to address these issues. I know I see a lot of gay men here at the Dana-Farber and very much want to acknowledge that there is, there are very real issues that need to be talked about, and people deserve the information and the support, regardless of sexual orientation.
Yep.
So, final question here. Are there any age limits to having implant surgery? I'm 78 and had radiation treatments in 2016.
Oh, goodness. Dr. Crawford, you would probably take that as much as better than me. I would say that I will just say I know that there are men of all ages who get implant surgery, and I think that probably has more to do less with age, but with physical function. But again, I would defer to Dr. Crawford to address that.
There are men that are having them in their late 70s. So again, it goes back to, are you still functioning active adult?
Right. Yeah.
So,
I will absolutely. And I will also just want to point out, and I say this all the time, if you look at who comes to see me at Dana-Farber and all the ages of people that I see, when my clinic days, I see people between often the ages of, mid-20s to mid-80s on a regular basis. I think that sexual health is a part of human experience across the adult lifespan in a very healthy and natural sort of way, and that there isn't a right or a wrong, and I really, again, I heard the gentleman who mentioned something earlier about, outliving different aspects of your experience, and people certainly have all kinds of challenges. But what I want to really just sort of end by saying is this: if sexual function, sexual health is something that is distressing in any way, if it is bothering you, if there is something that is not addressed, it's really important to know that, one, there are resources, there's help out there, and two, we can make things better. I am never coming from the perspective about how it is supposed to be, but what I would say is that if people are feeling some distress, please know that we can do something to help. And that's really where I'm coming from.
So, Dr. Bober, thank you very much for taking the time on this Wednesday and the 8th of January to kind of go over this topic that a lot of folks really don't have an opportunity to even discuss. And I think that hopefully what we've done is started to ignite or initiate this discussion with their healthcare provider about moving sexual health up to the front, instead of it's not something that's hidden in the closet and you have to deal with it by yourself. But again, I thank you. And if anyone in the audience has any additional questions, if you can send those to us, then we can always forward to Dr. Bober.
My pleasure.
All right.
Thank you for having me here. Nice to be here.
You're welcome.